Hello, this is Harry Hobson, President and CEO of Plymouth Harbor.
And I'm Karen Novak, the Administrator for Strategic Healthcare here at Plymouth Harbor as well.
Karen, I felt it was important for us to give an update today, although it's going to be a very brief update. Uh, of course, giving our campus numbers is always important to do, but also maybe talk a little bit about the positivity rate as we're seeing it here in Sarasota County and what that means to Plymouth Harbor. So why don't we begin with the campus update?
Again, we start off with great news by saying we have no residents that are positive here at Plymouth Harbor. We do have 10 of our SCC residents that are actually under observation for one of our team members that turned out positive. All of those residents are asymptomatic. They're being monitored closely by the nurses in the Smith Care Center, and they're doing all well. We do, like I said, have one team member in SCC that is positive. We also have one team member in AL, as well as the dining room, that are positive. All three of our teammates are out under quarantine. They're staying in their house. They're all asymptomatic, and we're looking forward to having them back on board. We do also have two of our team members that are under observation because they were exposed to that one team member that turned out to be positive, and they too are asymptomatic.
Okay, and that's due to contact tracing that I know
Indeed.
you do very well.
Indeed.
Okay.
That's where we kind of lose a lot of people with that contact tracing, and we're always cautious to make sure that we identify those people that had that close contact. And CDC has actually defined close contact is an accumulative 15 minutes in a 24-hour period. So sometimes you have to go back and really do that investigation by looking at minute by minute by minute and kind of adding all of those minutes up to understand that they are at risk for fulminating into COVID.
You know, you mentioned social distancing, and I think we all woke up this morning very early looking at some of the positivity numbers and also some CDC updates, which were really not a whole lot. But one thing that I took away on the CDC was that they're pretty much staying at the 6-foot distancing right now, and also dealing with gathering sizes.
Yes, I think that 6-foot distance is going to stay with us for a little while, although, they are looking at that 3-foot in the school arena. But right now for us, I think staying at that 6-foot distance is a great idea, as well as looking at our gatherings. I think, you alluded to the fact that we woke up to an 8.7 positivity rate for the county of Sarasota. And I'm going to share that it's not, including those people that are just down here for spring break. Those are Sarasota County residents that tested 8.7%. So it's not necessarily the spring breakers that are testing positive. It's what they're bringing probably and leaving behind, and that's the actual COVID itself. So we're going to kind of go slow again, still looking at that number. It was one day, but we're going to look at that accumulative 2-week period, and then we'll go from there and we'll evaluate some of our processes.
Karen, give some perspective to that, because, more recently we have been reporting a nice trending down. And then, as we said, woke up this morning and now we're back up again. So give a little perspective, historical, how that had been trending up until now.
Yeah, I want to say about a week to 10 days ago, we were seeing numbers that were less than 5%. And slowly we're starting to see those numbers creep up. It's creeped up 4, 5, and then 6, and now we hit 8.7%. A lot has to do with the vaccine status of people. We know that we have a more aggressive variant strain out there right now. Florida is leading the number of cases with that particular variant strain. We've got a bunch of people coming into our state that are very different. They're bringing whatever exposures they've had from wherever they're at into our community. And sometimes that has a negative effect for just a little while. And I think that's what we're seeing right now, is that incoming kind of surge, if you will. We're very lucky here at Plymouth Harbor in the independent side. We've not seen that surge reflected. And that's great. And we want to make sure that we don't see a surge here at Plymouth Harbor. We're very thankful for each one of you for getting those vaccines. It's really going to be very important to keep you safe.
Karen, I know you get questions. I've gotten questions even today regarding visitations and overnight stays and such. So let's go and gathering sizes. So let's go ahead and reinforce where we are today, and then we can talk about maybe looking forward and when that might be. So
You know,
let's start with gathering sizes.
right now the CDC is really stressing avoiding crowds or large gatherings, and even moderate size I think is coming out in the CDC guidance right now. And moderate is that 20 that we've hit, but I think we're going to stick with 20 here at Plymouth Harbor, but not venture much more than that right now. Encourage you, if you want to have that 20, to really make sure that you book an area for a gathering that can accommodate that. It's a beautiful time of year. You can be outside, out there by the Lanai area, by the pool, the colony gatherings in the little atrium areas on the East Garden, the West Garden, and the North Garden have some great areas that you can gather in. But two, remember, you want to keep those core measures of infection control when you do have those large gatherings or moderate sized gatherings. We want to keep that social distance of 6 feet. We want to make sure that you're wearing your mask, except when you're eating. But wear that mask when you're just engaging in social conversation. And remember to keep those hands, clean and washed quite frequently. And you can use that antibacterial gel, the alcohol-based gel. Their CDC is now saying that's really the ideal choice, unless your hands are visibly soiled, for good hand hygiene.
Karen, I know we're actually coming out of spring break, but occasionally we still get the question about overnight visitors.
Yes.
Hey, can you talk just a moment about that?
Sure. Again, right now we're seeing those numbers that are escalating. We're going to kind of hold off still on opening up to overnight stays. I know people are very anxious to have people come and stay, relatives stay in their apartments, but I think we're going to wait till probably the latter part of April, beginning of May, some point there, right around there. We're going to take a look at the numbers. We've always based our openings and our closings based on the numbers and the risk factor that's associated with those numbers. And I want to reiterate, 5% or less is a low risk according to the CDC, whereas 5 to 9.9% is a moderate risk, and anything 10% or above is definitely a high risk. And we've really got to start really clamping down if we get to above that 10%. But we're creeping up ever so slowly. So we're going to come out with this thoughtful process still of really looking and monitoring our numbers and kind of being aware of what's going on in our community before we fully open up to overnight stays.
Good. And we'll take another look at it, late April, very first part of May, and see where we stand, I think, at that point.
Sure. And we don't rely on just one day. We actually go back for the past 2 weeks and do an average. So again, we've got that first week of this 2 week period that had the low numbers, whereas this coming week that we're in right now, the numbers are a little bit higher. So hopefully they will kind of level out a bit.
I say it quite often, and I mean it, and that is how much we appreciate resident support on these decisions, and that's why we are where we are today, very, very safe. And I'm going to give you a specific. I just had a conversation here within the last hour. Residents stopped by and regarding one of their monthly social events, and their need is about 28 to 30 people in that colony, and was asking if they could do that, even in their atrium, if they could do it. And as I've always said, and you and I, we always get our heads together first, one voice. We look at the situation, and then we determine it's just not time yet. So we're holding that number at 20. Well, when I talk about resident support, I called the resident back after Karen and I had the discussion, explained the situation to her, and it's so good when a resident comes back and says, "I fully understand. I appreciate you looking into it. We're going to try to look at maybe another alternative in doing this." So That's what I mean when I talk about resident support. And I'll just say thank you again. So,
Absolutely. We're in this together and we can't do it without you.
right. Well, Karen, that's all I've got today. So why don't you lead us toward conclusion here?
Sure. We want to remind you to wash your hands quite frequently. Remember that alcohol gel that we just spoke about. Carry that with you in your pocket and use it quite frequently. Hit those high contact areas with the antibacterial wipes. And even though you're vaccinated, when you're out in the public, please remember to don your mask. It is the greatest, safest tool for you and those you love.
Absolutely. Well, Karen, that brings conclusion to this video. So that means it's time for us to don our mask.